Dr. Sunil Pai is a trailblazer in integrative medicine and vice president of the Neuroacupuncture Institute. With a repertoire ranging from functional medicine to herbal medicine, Dr. Pai is renowned for his evidence-based approach to wellness and his acclaimed book, An Inflammation Nation. Please click like to help Be Green with Amy. Welcome, Dr. Sunil Pai.
Greetings, Dr. Pai.
Thank you for inviting me today.
And greetings, Green Warrior. Green Warrior, if you or someone you know is grappling with the challenges of long COVID, with symptoms like persistent fatigue, brain fog, respiratory issues, heart palpitations, changes in taste or smell, gastrointestinal discomfort, skin problems, joint pain, muscle aches, mood changes, or post-exertional malaise, and you're seeking solutions, you are in the right place. Today, Dr. Sunil Pai, an expert in integrative medicine, will provide valuable insights and guidance on holistic approaches to addressing health issues like long COVID. We're also going to be talking about COVID as well. So, Green Warrior, if you have someone that you know have been affected by long COVID, please share your experiences and questions in the comments below. And before we begin with Dr. Pai's presentation, I have exciting news because I am thrilled to announce that we are hosting a book giveaway, giving you the chance to win a signed copy of Dr. Sunil Pai's groundbreaking work, An Inflammation Nation, the definitive 10-step guide to preventing and treating all diseases through diet, lifestyle, and the use of natural anti-inflammatories. Now, this book is going to offer you invaluable insights into harnessing the power of diet and lifestyle and natural remedies to combat inflammation and promote overall wellness. So to enter the giveaway and get your hands on this essential guide, just stay tuned for details on how to participate. So don't miss out on this opportunity. For those of you that follow me on BeGreenWithAmy.com or my Facebook, Instagram, and YouTube, you already have the information on how to do this. But I will also be putting the details in the show notes where you can find out how to participate. You're going to have up to 6 ways to win, and you're going to join us in spreading the knowledge and inspiration for better health. So Dr. Pai will be doing a presentation with us soon about COVID and long COVID. And I'm sure a lot of you have lots of questions. And please, I already have some questions that people have emailed to me ready to go. But if you are watching live, please feel free to do that. If you have a question, if you can put a question mark in front of your question, so I know that it's not just a comment, that would be helpful. And before Dr. Pai begins his presentation, we're going to begin with our game of true or false.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, Green Warrior. True or false, people who eat plant-based can still get COVID? Type in your answer, and Dr. Pai, please tell us about that.
True.
That's something that a lot of people might not think about, that even they think that they're protected from a lot of things. So does eating plant-based help us?
Yes,
If
it does.
we do
And
get COVID?
I'll explain that in the lecture.
Excellent, excellent. Okay. Well, let's see if we have, we have Boomer and Beyond Wellness. That's Angela Fischetti. She's been on the show a few times, and she said that she going to, here we have, she has an answer that she said true. Very good. Okay, we're going to go with our next question. True or false, people who eat plant-based had 79% lower symptoms when they get COVID. Okay, Dr. Pai?
True.
Okay, we'll see what the Green Warriors have to say about that. All right, Green Warriors, we have one more question, and then we're going to go into the presentation. True or false, people who eat plant-based lower their risk overall from getting COVID by 39%. Okay, Green Warriors, what do you think about that? Okay, Dr. Pai?
True.
Okay. Well, that was good. Good guessing, Green Warriors, and thank you for all that, Dr. Pai. And did you want to say anything before we began the presentation?
No, I'm ready to go, but thanks for everybody taking the time to listen to this program and learning a little bit more about long COVID and what you can do to help restore yourself back to better function.
Okay, well, we're going to pull up Dr. Pai's presentation and he's going to get started. And Green Warrior, if you have any questions that you want to put in, just go ahead and put them in the comments. And we're going to put it in full screen. Okay, here we go. And do you have that in full screen, Doctor? There we go.
All right, do you see it?
Yes, we do. Thank you.
All right. All right, thank you, everyone. My name is Dr. Sunil Pai. I'm an integrative medicine physician, formerly trained by Dr. Andrew Weil in one of the first classes over 24 years ago. So I've been doing this a long time. And I wrote a bestseller book called An Inflammation Nation, which I'm going to be referring to somewhat in this talk. But today we're going to talk about the ultimate guide for long COVID management, plant-based solutions and anti-inflammatory treatments, and what you can do, because right now there's a big, what we're calling the post-pandemic epidemic of long COVID. And a lot of people are not talking about it for a variety of reasons, but a lot of patients and people around the world are having these problems. So let's get started. My contact information is down here on the screen as well. So just a summary, just to explain inflammation for those people who just want to recap, is inflammation is understanding the triggering mechanism of almost every single disease. It's not necessarily the cause of the problem, but inflammation is related to every single type of chronic and acute condition. And more importantly, when we think of conditions that have the word itis, which I'll talk about in a second, that means inflammation of whatever the word is put in front of it. You know, from cancer to arthritis to diabetes to neurological, cardiovascular, pulmonary disease, autoimmune diseases, they're all inflammatory based. But one thing that came up on the radar was when COVID hit in 2019. This brought us another level of understanding inflammation. Even though I've been talking about this for about 20 years or so, and I wrote a book about it, it came to the forefront of everybody worldwide. Now, inflammation is known as what we call the fire within the body. And I like to always show this slide when I give lectures, is because it shows like we need a certain amount of inflammation. We need a certain amount of controlled inflammation here. So think of like how you cook in your kitchen or how you have your fireplace in the winter and you know, keeping your bed warm at night. You need a certain amount of heat, right? So the body uses inflammation as not just a pain sensory. A lot of people think, oh, pain and inflammation, they go together. But inflammation is also a cascade of a variety of communication signals, both good and bad, both working on cellular function, genetic function, and just organ function on how it's like to turn things up and to turn things down. So we need a certain amount of inflammation. We can't have zero. Okay. But the problem is most of us have what we call uncontrolled inflammation. So, you know, when you have a kitchen fire, your house is on fire, your bed's on fire, that's not a good thing. And that's where the problem of inflammation becomes too much. So the root of the word inflammation comes from and is derived from the word flam or fire. And basically it means itis, I-T-I-S. Okay. And so anything that we put in front of it, that just means inflammation of that area. And so when we look at, for example, chronic diseases are led by chronic inflammation. Okay, so if we have a healthy knee here, we get chronic inflammation, then we call it arthritis, okay, inflammation of the joint. We have a healthy colon down here, and we have inflammation of the colon, we call it ulcerative colitis, for example, Crohn's disease. When we look at in the cross section of a cardiac, you know, a heart vessel here, your arteries in the heart, you know, this is a normal, healthy person. And over time, when they're eating the standard American diet, having this layering of plaque, which is coming from cholesterol from animal protein. And also now we understand part of this plaque is now made out of microplastics, which is the last study that came out more recently this week. So there's a combination of environmental, both from food and the environment. But this is, you know, this heart disease is a pro-inflammatory condition. So the more inflammatory foods that we're eating, the more inflammation that we get for our heart and risk of heart attack and stroke. And same thing when we look at the brain, for example, when we look at a normal brain, and then we look at someone that has neurodegenerative diseases like Alzheimer's disease, Parkinson's disease, other kind of brain disorders, we actually can see that there's an inflammatory response. And that occurs where there's changes in the brain. There's tau, tangles, and proteins, and different type of aspects that become disruptive of how those neurons work. And so right now, the problem with conventional medicine right now is that we have over 200 different itis conditions. You can look at dermatitis on your skin, right? Inflammation of your skin, conjunctivitis of your eyes, rhinitis, runny nose, sinusitis, a pharyngitis, sore throat. You can have thyroiditis, with the thyroid. You can have, reflux or esophagitis. You can have stomach pain, gastritis, colitis, prostatitis, vaginitis, arthritis, right? So those are the common things, but there's 200 of these type of inflammatory conditions. But we always want to look at what's the underlying triggering cause and mechanism of inflammation, not just treat symptoms. And, what's worse about inflammation is not only just the chronic issue, and the long-term chronicity leading to chronic disease, but also inflammation is a pathway to cancer over time. So like 43% of patients that have inflammation in their colon, ulcerative colitis, will develop, in about 30 years on average, colon cancer. Patients that have rheumatoid arthritis over 10 years, if it's not under control, have a 71-time increased rate of getting lymphoma, which is a type of cancer, than the general population. And then, most women have heard and are well versed about understanding the role of HPV when they're going and getting their gynecological exam, and they're finding out, okay, they do the pap smear. And if you have HPV positive, then although it's not the cause of the cancer immediately, it can lead to chronic inflammation. In 10 to 20 years, that patient, if it's not controlled correctly, can turn into cervical cancer. But what we want to look at is what can we focus in on first, right? Because what we understand is that diet's the largest contributing factor. So that's why you want to be going plant-based. And I'll explain that a little bit more in detail. We want to be lowering our weight. We want to definitely not be smoking. And, this infections was normal. It was like an issue that, most of us can get sick. We can get flus or colds. And, some people are more prone depending on where they live and their immune system. And, environmental things, which is now a bigger contributing cause that we're starting to see with plastics and forever chemicals and other things that we can talk about. Genes is actually, it's about 5 to 10%. And some of the studies now are looking at it less than 3%. So, and that was the most recent studies saying about 3%. So we want to focus on the 97%. A lot of people are like, oh, I want to take a genetic test. But if you focus in on the 97%, this is where you're going to get your biggest gains on health moving forward. Now, inflammation likes to go to 4 places. And in my book, I give these examples. In New Mexico, we have these flat New Mexico roofs. I'm from Albuquerque. We have these wonderful Southwestern style, kind of Adobe style homes. However, they have flat roofs. They're not pitched like most places. So there's a tendency for things to collect on the roof, especially water. So I like to give the analogies when I talk to my patients, and when in my book, I express this very easily because I want to take complex ideas and make it simplified so the average person can understand it. But the first place that inflammation likes to go is, when I'm talking about the roof leak, for example, is the weakest point. So wherever someone has a weakest point on their roof, that is where the roof leak will occur when it rains. And so trauma is the first place in the physical body, in the past or present. Think of the roof leak that once it gets damaged, and then you call the roofing company and they repair it, it's really never 100% fixed. It's about 99% fixed. And thus, there's still a likelihood that if there's going to be a leak in that area, it's going to be in that area of previous trauma. So just think of the small amount of itis. There's a little bit of a pilot light. There's a little bit of a gas leak there. There's a little bit of an area where maybe the roofing material wasn't put on appropriately, and that just leads to a higher rate if there's more inflammation coming in to go to that area. Pathology just means disease. So think of a tree. If it hits your roof and it falls and it creates a little dent, then anytime it rains, the inflammation will go there. So most of us have some type of trauma or pathology. Sometime it could have been in the past, getting a car accident, playing sports in college, or just recently getting COVID. We'll talk about that. Overuse is just that you can have more inflammation than you need. So for example, a lot of people who work repetitive job injuries, right, like say carpal tunnel. So you're a checkout at or a bagger at a grocery store, right? You're constantly moving your arms in one direction, or say maybe you're typing, or maybe you're a construction worker on your feet all day long. These are areas that have repetitive motion, and that causes some inflammation to the tendons, muscles, and joints. And then anything that is coming in that's pro-inflammatory into that person's diet will contribute to those areas to act longer. And lastly is places where your immune system is not paying attention. What that means is that when your immune system is not strong, we like to check vitamin D levels and give things that will help increase increase the patient's natural killer cell functioning, like glucan 300, other things which I'll mention today. There are ways that we can look at getting your immune system stronger. Going plant-based is the first and foremost important aspect of helping your immune system, but there's also natural agents that actually can boost that up even more. So when we look at inflammation, I always talk about this stacking effects of inflammation. And so there's a certain amount, as you can see, that there's a certain amount of inflammation, just like when we have a levee, there's a certain amount of water that can go up and down, which is normal. So your body's going to have a certain amount of inflammation, say like in your knee. It's going to be a certain amount of inflammation and wear and tear. But when it gets too much inflammation, then there's going to be a flare. It kind of crosses that levee. And then eventually, if it's chronic or too much over time, that levee will break. And then it spills, and that inflammatory condition that's just local then can start spreading. And as we see now with most inflammatory conditions, patients will have one, and over time it starts to spread because it's a systemic issue. It's not just a local issue. The local issue is just where there's some trauma, pathology, or damage. And now we're looking at then, inflammation can spread all over, and it can even create more serious conditions. So in my book, I cover main aspects of what we look at inflammation. We look at, smoking, solar radiation, alcohol. Again, I have a big section which I talk about, and I'm glad that most people are looking at or are already eating more plant-based standard American diet. Environmental pollutions and stress. But when we look at infections, parasites, bacteria, funguses, viruses is something that came to the world's halt, understanding like, wow, there's something else that's in this picture that we really didn't take seriously that became a huge problem. And that was COVID-19. And when COVID-19 hit, what we understood, and now that we understand even better, which I was speaking to you about a long time ago, even before COVID, was talking about, illnesses that would create the systemic inflammatory response. So it's not just diet, it's not just environment, but even infections. And this virus came in, and it really caused, aside of just having like this flu-like symptoms, cough, shortness of breath, muscle ache, diarrhea, loss of, smell and taste, and fever, chills, it really, really had a dysfunctioning effect on our immune system. It created what we call cytokines, and cytokines are these productions of signals, and certain of those signals are pro-inflammatory, and it basically just lit these up like a Christmas tree. It also had a dysfunction of the immune system, so patients' immune system weren't able to actually fight as effectively as we would want. It was actually sometimes of confusion. So certain cells were suppressed, certain cells were elevated in the immune system, and that means, just in short, like the military was given signals, but the Border Patrol was trying to do the Navy's job, and the Army was trying to do the Air Force job, and nothing was getting done correctly. And there was just a lot of chaos of inflammation going on. And, since 2020, and now it's 2024, COVID-19, it's still going on, and a lot of people are not talking about it. We're in an election year, and most of us are past it because, we're tired and exhausted. We want to get back to work, and the controversy of just wearing masks and vaccines was so much that even the CDC is kind of backing off. Everybody's like, hey, you're on your own. But it's still the third leading cause of death now from 2020 all the way to 2024, COVID-19. So behind heart disease and cancer, COVID-19 is still occurring. Now, in the United States, we have the largest world's economy. We're spending $4+ trillion in healthcare. We're 4% of the world's population, and we're still having 15% of the COVID cases worldwide. And in 2020, when it was at its peak in the pandemic, we were at 25%. We had 1/4 of the whole world's case populations. And currently in the United States, there's over 1.2 unfortunate Americans who have died from COVID, which is a huge, huge tragedy. And this is data from last week. So we can see right now, 111 million cases, 1.2 million people died, 109 million people have recovered. And then comparing it to worldwide, again, 7 million people, this is a very high number. Even 1.2 million people, when we talk about it, it's about the size of Dallas, Texas, just taken out by a virus, right? And you can see that we're a pretty large number, and though all good that we're recovering mainly, we have to understand, like, why are we a larger disproportion of getting COVID symptoms and getting the virus itself? And this is because we're not as healthy as we proclaim. The state of health, as most people know, is that the more comorbid conditions, meaning the more medical problems that you have, the higher rate of having COVID, number one, and more importantly, the higher rate of getting COVID complications like long COVID. Okay. And it doesn't mean that, if you can't, like the question said, like, oh, well, what if I'm plant-based and I don't have any problems? You can still get COVID and you can still have long COVID, but that risk is much, much higher when people have high blood pressure, diabetes, obesity, lung function, heart function, kidney functions, coagulate, blood clotting issues. And when we actually looked at the data in early COVID, you could see that, in the younger population, obesity was a big problem, and obesity is still a big problem in America. And then as we get older, it was more of like the chronic issues of like heart disease and lung disease. And so there's a combination that, the younger patients who had complications was actually due to a weight issue. And then as we got older, it's due to some of these lifestyle diseases of not eating healthy and living healthy that was affecting the older population. But once we start to stack these risk factors, then the person having a complication from COVID, and more importantly, long COVID, was much higher. So what it tells us that we are an inflammation nation, and this is what my book covers up into detail. But today we're going to talk about COVID and the long COVID economic fallout. COVID-19 cost $3.7 trillion. That's a lot of money, $3.7 trillion to the economy, and extra medical costs was about $500 billion, $528 billion to the economy. And now going forward, long COVID, which I'm calling is the epidemic now that's, from the pandemic that's going on the low estimates, because we're still in early data, but the low estimate is costing us about $170 billion in lost wages right now. It's about 1% of our GDP, our gross domestic product. And the average cost to the individual that has long COVID is about $9,000 in additional health expenses, which is a lot of money. So we're going to talk today about how we can improve that. Now, long COVID, what we'll talk about is symptoms. So when people get COVID, in general, most people, thankfully, can get COVID, like flu-like symptoms. And then after a couple of days, fever, backache, headache, GI symptoms, cough, respiratory, etc., it goes away. Okay? But for some of us, it doesn't go away. And some of these symptoms can last more than 3 months. On average, the data will show between 15 and 27% of the population. The average of that, when they look at the data, is about 17% in general. But in 27%, so it's higher risk in certain populations that have higher risk of health risks due to economics, due to access, due to overall health care and health conditions. And also there's gender differences. Women actually have a little bit more long COVID than men. But 17% of adults, which is a lot, because when you talk about the 100 million people that have recovered from COVID, 17%, so it's about 17 to about 25 million or 30 million in the studies now reporting that many people. And there's about now 445 million when we look at all these other subcategories of people and counting. Okay, so that's a lot of people that are having long COVID. Now, the risk, again, is higher for those people who already had COVID. So if you had COVID once, particularly if you went to the hospital, a longer risk, right? That just means that they're more unhealthy and they had already complications. So once again, there's trauma to the roof. Once there's a pathology or disease or dysfunction, then anything that's the virus coming in will cause more problems. But then also people that have obesity, high blood pressure, smoking, diabetes, heart disease, as I mentioned before. And also people who are unvaccinated would also have a higher risk of also long COVID because they just didn't have any stronger immunity. Now, what the symptoms are is this: fatigue. People feel like their battery is low. I mean, I have patients who are physical trainers, and they would, they own companies where they're actually training people. They're in the gym all day long, and then they get COVID, and now they can barely exercise, and actually exercise actually makes them feel worse. They actually get more depleted and tired. Shortness of breath, coughing, high heart rate, increase more upper respiratory issues. Even previously in patients that didn't have asthma or bronchitis issues now are getting more and more lung conditions. Neurological conditions is another thing that we see is brain fog, memory, cognitive issues. There was a study that just came out 2 days ago showing that what the brain fog that they're studying now in these patients, when they were doing in a subsection of patients who got extremely sick, they were looking at why are these people having memory cognitive problems. And, when people got COVID, it was significant. In some patients, they were losing IQ points, but not a little bit, a lot. So we had people that, I have people who work at these really high-end laboratories in my state, Sandia Laboratories, Los Alamos. This is like Oppenheimer. You think of like these really, really, astrophysicists, nuclear physicists, and they get COVID, and their cognitive and math skills have declined significantly. But we now have a study showing that there's proteins that are leaking out of the blood-brain barrier, and there's molecules going in between and out. Just like we talk about leaky gut, where the gut barrier can be dysfunctional from the virus, from other things in the environment as well, which I'll talk about. But now we understand that there's almost what we call like a leaky brain, and so we have to look at the more anti-inflammatory things that you take, the better. Anxiety, depression, now being seen in patients who had no history of anxiety, depression, or mood symptoms, and then definitely GI symptoms that are continuing, bloating, diarrhea, muscle pain, and even changes in menstrual cycle in women. So today we're going to talk about the solutions. We're going to talk about first eating a plant-based diet, the benefits of that. We want to talk about checking food and environmental sensitivities, because what we want to look at is that once you have inflammation in the body, what are the other triggers that we may be eating, even if we are plant-based, that's still contributing to the inflammation. Also environmental sensitivities, because especially for those people who have lung issues, oh yeah, now I'm having more asthma or wheezing or cough, then we all want to look at what was already there that was probably bothering them, but their immune system was strong enough to fend it off. Now it's becoming more of an issue. We want to look at microbiome, looking at overgrowths in your gut, dysbiosis, leaky gut. We want to look at nutritional deficiencies, oxidative stress, mitochondrial dysfunctions. We want to look at things like your fatty acid ratios. Are you anti-inflammatory, pro-inflammatory? And also look at the environment, toxic elements, because although we're all getting exposure, unfortunately, to toxic elements in the environment, what we want to look at is that now that someone is down, those toxic elements might be more harmful, because the body's detoxification, the body's healing process, and kind of restorative processes are not as up to par as they were before. We also will talk about checking for certain aspects and testing for Epstein-Barr, thyroiditis, and blood sugar problems in chronic fatigue patients. We'll talk shortly about anti-inflammatories like our bestseller Bosmeric, which we have wonderful clinical data, particularly for COVID, that was being beneficial at lowering the inflammatory cascade. Now that can be useful not only during, but also post, and then adaptogens, other things, and then the treatments, lastly, of when people have physical ailments. I have gait instability, I have weakness, I have trouble walking, I have trouble with balance, I have dizziness, I have taste and smell, and other issues. There's treatments now. We'll talk about it with neuroacupuncture, a specified training in acupuncture, and we'll explain that. And also there's newer technologies now, wellness technologies that we've been using for a long time, but that we've been using in these types of patients that have fatigue. I can barely move, I'm exhausted. And now we can increase nitric oxide, cellular vascular health for those people who might have more inabilities or mobility problems. And that's something that would be safe and effective. And we're going to talk about how we can provide some of these to anybody who'd want to come in for evaluation. But first, let's start off with solution number one: plant-based proteins versus animal proteins and saturated fats. This is a slide, if anybody has known me speaking, this is like my favorite slide. It's probably the most copied slide of any of my lectures that I start now seeing on the internet. But we want to look at, plant proteins are anti-inflammatory. They're high in omega-3s. They don't have cholesterol. They're high in antioxidants, high in phytonutrients. They have fiber. Increases microbiome diversity, doesn't have these cancer-causing chemicals in there. It lowers blood sugar, it reverses heart disease, and more importantly, the most recent studies, out of all the foods, plant foods have the lowest nano and microplastics, where comparatively, animal protein and saturated fats is just the opposite. High in inflammation, right? And we have all the studies now. It increases CRP, interleukin 6, TNF alpha, all pro-inflammatory markers. So we actually can physically measure inflammation from people eating these foods in the studies. High omega-6, which is pro-inflammatory when there's too much. Again, cholesterol, number one cause of death in America. So COVID is number 3. Heart disease is number 1. 3 people every minute have a heart attack and die in the United States. There's very little antioxidants in animal protein. There's no phytonutrients, right? That's like all your colorful foods, right? When we think of lutein, lycopene, we think of, resveratrol, we think of things like, EGCGs and all these flavonoids. Only plants have them, phytonutrients. And that's why people who eat these heavy animal protein diets then end up taking a green drink, a red drink, multivitamins, and tons of these kind of substitutes where they're not getting it from their highly nutrient-dense plant-based diet. There's no fiber in animal protein. It causes dysbiosis, gut dysfunction. It triggers all sorts of kind of cancer growth signals, especially insulin growth factor, increases insulin resistance, meaning the more animal protein and saturated fat, the more blood sugar problem that you have. And in the studies more more recently we'll talk about is the bioaccumulation of pesticides and herbicides. So, these things concentrate in the environment, they concentrate then in the animal. The bigger the animal, then the more concentration of the bioaccumulation. So like the bigger the fish, say like a ahi tuna would have the most amount of pesticides, or a shark steak would have the most amount of pesticides from the ocean. But now we're looking at micro and nanoplastics. Again, when they looked at arterectomy studies, when they're looking at patients who had stroke and they do the ultrasound of their neck showing the clogging of the arteries, 60% of those people, when they look at the plaque, actually have nano and microplastics in them, right? So this is from bottles of water. This is from the environment. So make sure that you're drinking from glass. Make sure that you're using ultra filtered water, like either reverse osmosis or a Berkey filter or something like that. But we want to make sure is that in the studies, when they were looking at, well, gosh, we're all getting exposed to microplastics and nanoplastics. What foods have the highest? Well, again, those people who eat beef, for example, since the cow is the largest animal of them that they're eating, that cow's meat is highest concentration in micro nanoplastics because it's from the water, right? So these are things that the larger the animal, the larger the consumption. So now we're looking at not only pesticides, herbicides, and hormones, but now we're looking at microplastics. So you want to be eating a plant-based protein diet, plant-heavy diet, a plant-forward diet, but I just want to say a whole foods plant-based diet because it prevents, treats, and reverses diseases. Animal proteins and saturated fats does the opposite. Now, solution number 2. So now that we've understood that we need to be moving towards a plant-based diet, or if you're already eating a plant-based diet, but you're still having inflammatory issues, particularly after COVID, what that tells us is a couple of things. And what in my book, I go into this in much detail because I talk about my personal history of having food sensitivities and allergies. I actually have the anaphylactic allergy. So that's really near and dear to my heart. I'm one of the peanut allergy people. So I grew up, having this issue of going to the hospital, carrying an EpiPen, but understanding allergies near and dear to my heart. So that's an area of specialty of understanding immune reaction. There's 2 types of reactions that you can get from eating a food. You can get something that's an immediate reaction, an IgE, within an hour. Think of it as a text. You get a text message, you're going to answer within an hour, or a phone call. We're not talking about anaphylaxis here, okay? So a lot of doctors, and this is where I want to distinguish, a lot of MDs, this is the challenge with MDs looking at food sensitivities. MDs are looking at the things that can kill you in general. So they'll do a panel, they'll do a blood test about 8 things, eggs, shellfish, peanuts, melons, certain like things like that, dairy and whatnot. They're looking at things that, okay, if your child eats it or you eat it and you get mouth swelling and your vocal cord, your windpipe closes up, you get asthma, you cardiovascular collapse, here's an EpiPen. We're not talking about that. We're looking at now 90% of people can have an IgE immediate reaction that's not life-threatening. So if you have an IgE and you see a regular doctor and they go, well, do you get mouth swelling? You say no. Then they go, okay, then don't worry about it. But what we're looking at is all inflammation. So we're not looking at this, the life-threatening. That's only 2%. So let's not count those people. We're looking at all the other 200 itises. What are the foods that are coming in that can trigger something within an hour? Now, on the flip side, there's a second type of reaction that your immune system has. It's called an IgG. We specifically test IgG4. So it's a little bit more sensitive and specific. It's a delayed reaction. What that means is it happens a few hours after you eat the food, up to 4 days later. So say you got a mail, like you're getting like the old fashioned, I'm kind of dating myself, but we used to write things by mail before email, and we would lick a stamp and put it on a letter and send it in the mail. And say if you're sending it, say, from California to New York, it might take up to 4 days to get the letter. And so there's 2 types of reactions. One happens immediately, like getting a text, send your troops out. And another one's like, hey, we're waiting. We check the mail. They go to the mailbox, and it could be several hours after you ate the food, 2 days later, 3 days later, or 4 days later, it finally gets the mail and it sends out that inflammatory reaction. Okay. They're not life-threatening, but these are the levels that you can eat a food and have a problem now, a problem later. You can have some foods that are now and later, and hopefully you have many foods that are no problem at all. So that's what we want to look at, because if someone's still having inflammatory issues, body ache, muscle ache, anything that's going on, any kind of itis condition that they've been told that they have, you want to look up what foods are coming in. And just because you're plant-based, and just because plant-based foods are anti-inflammatory in general, we're now looking at individually, what is the individual's response? So now we're getting to individualized medicine, not just like, okay, we now know the population should shift to a healthier diet, anti-inflammatory plant-based diet. However, now we want to look at, well, why do these people still who eat plant-based, organic, or green still have inflammatory responses? Because their immune system still reserves the right to say, hey, I may not like avocados or blueberries or a kale, for example, or tomatoes. Even though we love to eat it, it still might be triggering an inflammatory response. So that's my specialty, because we want to look at first what's coming, and that's knocking that person down. Now, if anybody has respiratory problems, particularly post-COVID, and they're like, yeah, I'm having now wheezing, I'm having more asthma, I'm having more bronchitis, shortness of breath, then we check the environmental allergies. We want to look at the grasses, the weeds, the trees, the molds, animals, dust mites. Now, most people will have some type of environmental allergies. Not everybody, but most of us do. But sometimes it's not that bad. It's like, oh yeah, just the windy days, or when we're cutting the lawn or we're pulling the weeds, it might bother us, but not all the time. And some people have to take antihistamines all the time. And then when they get COVID, because they already have a pre-sensitive area in their lungs, they went down. When people had lung problems with COVID, the higher risk was those people who already had asthma or allergy or bronchitis or any kind of lung problems, or smokers or vapors, for example. Anything that was more disruptive previously to COVID to having with the lung issues, they would have more. So we want to test that, because the reason is that even though before COVID, their body was strong, the immune system would take care of it. Now, as that levee has broken, those environmental allergies are coming in, and that's triggering more respiratory issues. Because the virus is long gone, they're still not having lung issues because there's still an inflammatory trigger, and we can respond. There's ways that we can also, not only when we get the allergies, whether it's a food or the environmental allergy, we can actually treat it. We can avoid some of those foods. We can rotate those foods back in a systematic, methodological, scientific fashion, so the body can become more tolerant to those foods. And even if need be, we can even do sublingual immunotherapy, which is called allergy drops. That's described in my book, or you can look on our website. It talks about that. Like, we can actually train the body to go to the source of the allergy and learn how to tolerate it, instead of just treating symptoms with like antihistamines, for example. For respiratory issues particularly, we can actually dose and treat people like they've been doing in Europe for about 40 to 50 years, very safely and very effectively. You don't need allergy shots. We can actually do something that's a meter dose pump under the tongue very safely and accurately. Now, the stacking effects of food, what I want to explain about that just real quick here is that, remember, you can have an immediate reaction to food. You can have a delayed for food. So some people might have, like in this example here, it all depends on how much you eat and how often you eat, and that stacking of it can trigger. So here I'm just putting a taco. It's not plant-based. So for those people who are plant-based, I only eat plant-based also myself, but this is an example. So the average person coming in my office may not be plant-based and is like, but I'm eating healthy, organic. But say they had like an immediate and delayed for wheat, an immediate for dairy, a little bit delayed for tomato, immediate for avocado, and a little delayed for chicken. Although if they ate those things separately, it may not bother them that much because the levee hasn't been breached yet, but they might have one meal that they're stacking a variety of things on their test that their body's sensitive to, and then they eat it, and then their symptoms would flare of anything in itis in the body. So we want to look at all the foods, even those people who are plant-based, and we have plant-based panels specifically for people who are plant-based, and then we have the standard American diet panel for people who eat everything else in between. Now, solution number 3 for long COVID is then looking at the microbiome. So we looked at the environmental allergies. We look at the food triggers. Those are things that are coming in that we, directly or indirectly, that we have control or no control over. Now we're looking at when people have like reflux, then they have bloating, they have stomach pain, they have diarrhea, constipation, or sometimes weight loss after COVID. They didn't really have these symptoms before. Now we have testing where we can actually understand the microbiome. And I was actually talking to a scientific group this morning, because they were actually, there's a testing company that came up, and they were like, they have a new test where they can also test the microbiome. And I was asking their immunologist a lot of questions, because like I've been doing these tests for like now 24 years, and there's a lot of experience you get by looking at certain things on tests. So everybody right now who's like a functional health coach or something like that, they can order a test. But I get patients every day, particularly from the larger cities, who see practitioners and have tons of testing done, but the practitioner doesn't have the experience of explaining what to do with it, right? Anybody can order a test. At the end of the day, Alexa's going to order your test in the medical system someday. But what we want to look at is like, do we have the experience of understanding? And that's what I'm able to help provide my patients. But we want to look at is like, how's their digestive enzymes functioning? Is their protein and fats high enough? Are they getting enough fiber in their diet? Are they feeding their microbiome? And some people who are actually eating healthy prior to COVID, but then they got COVID, we can actually see inflammation in the gut. We can actually see the soldier cells start lining up. And more importantly, we can see inflammation causing what we call leaky gut. It's an increased intestinal permeability where the food comes in, but the nutrients aren't absorbed correctly in this 30-foot tract of our gut, 35-foot tract of our gut. And that causes more food sensitivities, that causes inflammation, that also causes nutritional deficiencies. And those people are having bloating. So a lot of people are like, oh gosh, Dr. Pi, I got COVID, and then now I'm getting bloating. I'm still eating the same diet, haven't changed anything. They might even be completely plant-based, but they're bloating. They wake up in the morning, their stomach gets bigger and bigger, bigger. By the end of the day, they feel like they're pregnant, or they have to change their pants are feeling, or their skirt is feeling tighter. And we can now measure the overgrowth of certain type of bacteria that produces gases like hydrogen, methane, hydrogen sulfide. It's called SIBO, small intestinal bacterial overgrowth. These are not infections. These are just imbalances and dysfunctions. And then we can actually treat them with either medications or natural therapies or combinations in between. When we look at further things like, people having the diarrhea or constipation, we also want to look at like dysbiosis. So we can actually now measure, is there bacterial overgrowths? Again, not infections, not a uncooked something, or someone didn't wash their hands. We're not talking about those type of GI illnesses, okay? And the test will test for those, by the way, certain pathogens that are infections, but those are less common. We're looking at things that people are like, I'm always bloated, or I'm always having diarrhea now, I'm always having constipation. And they might have gotten antibiotics in the hospital. They might have gotten antibiotics because they had bronchitis. They might have been treated. And now we can look at things and say, like, is there bacteria? The nice thing is that when we evaluate microbiome, it takes about 3 weeks to get the test results back, because they actually grow the bacteria and they identify it. So each test is different. We're not seeing some standard panel, here's 2 or 3 things and everybody gets it. What we're looking at is like, what does that individual have? Some people might have 2 things, nothing. Some people might have 12 things. They'll identify the species. And then here, like you can see, there's an additional of overgrowth of bacteria. There's actually a mycology overgrowth of candida, or there could be yeast or different types of fungi. It'll identify it. And more importantly, this is one of the most important things. We have to look at the sensitivity and resistance to treatments. So a lot of doctors, conventional and even natural doctors like naturopaths and chiropractors and holistic doctors, a lot of people will throw antibiotics at it or natural antibiotics at it. But we want to know, does it work? And so we want to look at sensitivities and resistance, not picking something that I like or the patient likes, or the rep who's coming in as a nutraceutical or supplement rep, or a drug rep that comes into office and saying, hey, this is the latest and greatest. We want to test, is it resistant to the treatment, or is it sensitive? Does it work? And then for me, since I like to look at more using the natural agents, I want to look at the natural agents, say like which one is stronger, which one is more effective, so that we're getting ahead of the overgrowth and not just taking something that we like. Okay, so we're always using the evidence of science, understanding how to apply it, but also applying it with natural things and not always having to use drugs. Now, solution number 4 is when we're looking at nutritional deficiencies, oxidative stress, and mitochondrial dysfunction, because most people then get tired and fatigued, right? And when they get tired and fatigued, I have people all the time that come to my office, and they're actually those who are eating plant-based. I mean, then they're super plant-based by the time they see me sometimes. And they're like, hey, I'm juicing, I'm eating this much. I'm getting my 35 grams of fiber. I'm getting my 50, 60 grams of plant-based protein. I'm eating rainbow colored foods, et cetera, et cetera. I got COVID. I'm extremely exhausted. I can barely get out of bed. I can barely function. I'm so tired. I don't know what's wrong with me. And when we test their microbiome will be off. And that affects then also their nutrition. And as you can see here, all their antioxidants, ACE, CoQ10, glutathione, how are they detoxifying all their B vitamins, not just folic acid and B12? Oh, because you're plant-based, we just need to check your B12. We look at all the B vitamins, all the minerals like magnesium, which covers 300 different reactions of the body, from blood pressure and constipation and mood and cognitive function, all your essential fatty acids and omega-3s. These are important because when we look at this, now we're analyzing cellular energy, because it's like a hit. The person's taken a hit. It's like they've been hit by a truck. They're knocked down, but we now have to rebuild them back system by system. And it's not a simple drug approach where it's like, oh, here, take an antidepressant, or here, take a anti-anxiety pill, or a sleeping pill, or a pain pill. We actually have to restore all the functions of all these different levels, because that's what it takes, because the virus had that large kind of scalability throughout the whole body to different systems, and it causes dysfunction and disruption. And we can restore that. So a lot of people will come in and say, gosh, I'm eating a perfect diet. And we can show them, this is why you're feeling tired, because your nutrients are low. Now, it's not just, okay, here, take a supplement. Now, the interesting thing is that it will tell us, and the test will then point us on the foods. Remember, food is medicine, and we've been practicing that since 2006. Really hardcore in my practice. I have the largest plant-based practice in the Southwest right now, and it's amazing because we can then focus in on which foods have those nutrients. So you're eating the food as medicine, and then if there's needed something that is harder to get from the diet, or they say have sensitivity of those foods, then supplementation can be provided. But remember, Food is medicine, and supplements only supplement. Supplements are not a replacement for the food. And so we're really good at targeting, if we find or we provide a supplement, it's evidence-based and we're getting the right potency, purity, safety, and efficacy of those. Now, going further with solution number 4 is then when we're testing the nutrition, we also want to check their essential fatty acids. Why? Because we want to see, are they in a pro-inflammatory state or anti-inflammatory state just from some of the foods? Now, we were talking about the food allergies. We talked about looking at, eating more plant-based. We're talking about also sensitivities individually of their immune system. But we're also looking at, like, of their diet, are they getting enough, ALA in their diet? Are they eating enough flax, chia, hemp, walnuts? And those people who aren't plant-based, are they still getting omega-3s or not? Which can still have problems like with salmon and stuff. Like there's still contamination and it still has cholesterol, no fiber. But we want to look at it like here, like, is there omega-3s? Are there EPA, the fatty acid that is anti-inflammatory? Is it high? If it is, great. This also helps lower their cholesterol and their lipids, the EPA. And the DHA is the part of the fatty acid that's for brain health. And if we see these are low in the patient, then they're complaining of, like, gosh, I have more inflammatory problems, I have more cognitive problems, right? And this patient just needs to eat more from their diet. It'll also tell us, do they have the enzyme? Is their body able to convert the omega-3s from their diet? There used to be some data showing that, oh my God, you had to take fish oil or omega-3 fatty acid, and now we have plant oils. I was actually one of the first people to actually introduce, through a company out of Canada, plant omega-3s, which is now almost the industry standard, sustainable and safe and effective. But we can actually see, does a person who eats the omega-3 from the diet, does it convert it? Now, we still want them to eat it if they don't convert it. At least you're getting the fiber, the phytonutrients, the antioxidants, and the protein. But are they getting the EPA and DHA? And we can actually test. So some people, if their enzyme, their delta-6 desaturase activity is functional, then I'm like, hey, don't take a supplement. Just eat more flax, chia, hemp, walnuts, for example. If it is impaired, then sometimes taking a supplement is targeting if their levels are low. But we can look at their omega-9s. We can look at their saturated fats, their omega-6s. If their omega-6s are high, they're in a pro-inflammatory state if their omega-3s are low. And this is why we want to do, switching more towards a plant-based, or moving completely to a plant-based diet would be the optimum. And looking at, then finally, is looking at toxic elements. Because again, as I mentioned before, we're now getting exposed to lead, mercury, everything all the way down to uranium and arsenic. And when I work with my patients, we actually look at their specific municipality where they live and their water report, and then when we do the testing, we can then match, like, if they have, like here in Albuquerque, we have a high arsenic, we have high uranium in the tap water. And so if someone's just like, oh, I just have a little carbon filter in the back of my fridge, well, the carbon filter doesn't take out arsenic or uranium, and if they come back here, which you can see down here, which is that uranium's high, this person doesn't have a filter. But we can also see other things that we have to look at, whether it's medical, like gadolinium, which comes from scans, to aluminum, which is a toxin, or arsenic or lead or mercury. We also look at toxic nutrients like copper levels and other things that in general, if it's too much, becomes pro-inflammatory and puts patients at higher risk of pro-inflammatory conditions. So that's for solution number 4. Now, solution number 5 is for those patients who have chronic fatigue. You want to make sure that you talk to your doctor, or if you see me, what we do, if you say, I'm so tired, I have not recovered, and I was never a tired person before this, then 30% of patients that have, this is in the data now, 30% of patients that have long COVID, that have fatigue, have reactivation of Epstein-Barr virus. Epstein-Barr virus is the monovirus. Now, most of us have had Epstein-Barr somewhere in our life that we don't even remember. And you don't have to be sick in high school and, been out for three months and not play football, et cetera, and have, swollen lymph glands. Most of us get exposed and we get sick and we develop antibodies, we're done. But what happens is that virus is kind of kept dormant, and now 30% of the patients that get COVID, it reactivates, it re-stimulates it, and then it's up and going. So that's one thing, because there's certain natural therapies that we can do that will affect and lower Epstein-Barr virus. Double the risk of Hashimoto's. So people, again, gosh, you might have never had abnormal thyroid, and in fact, your doctor may not have checked your thyroid. You definitely want to not only have your TSH, but your free T3, free T4, and also looking at both antibodies against thyroiditis. That's an autoimmune risk that the virus then triggers in the thyroid gland to cause dysfunction. And when people become hypothyroid, they have more fatigue and exhaustion problems. Again, those who didn't have COVID before have a higher risk after when they have long COVID. And interesting enough, 10% increase in hemoglobin A1C. So this hemoglobin A1C is your 3-month blood sugar average. So those people who have COVID, they have a risk of getting prediabetes or diabetes. So if people were normal, it went to elevated, and people who are kind of in the mid zone, we call insulin resistant, became diabetic, even when there was no change in diet. Even people who were eating plant-based and were normal, they had bump up in blood sugar. So there's something that we have to look at how that virus affected our blood sugar, and these are things that I recommend, again, testing in those chronic fatigue patients or asking your primary or your specialist to do so. So what we want to talk about is then what do we do now to treat inflammation? As you know, I'm one of the, I would say, international experts for over 24 years now using natural therapeutics, evidence-based wise, looking at patented formulations, and curcumin is one of them. You know, we've created a product, and this is something that we've now been using now for over 16 years and tens of thousands of patients worldwide, and probably the number one product that's been used in most clinics. And it has a 20-minute onset of action and an 8-hour sustained release of 4 synergistic anti-inflammatory ingredients. The right form is the one that have been patented. What you want to do is you want to avoid NSAIDs. And if you want to know more about NSAIDs, read my book. If you don't know what a black box warning is, a black box warning is a warning that is put on a product that tells you that you can have a side effect that will put you in the black box, which is basically denoting the black box, which is a casket. And when you look at ibuprofen, naproxen, celecoxib, these are the molecules of like Advil and Motrin and Celebrex and Aleve. These all have black box warnings, which means that you can have a heart attack or stroke or a GI bleed, even taking one at one time. And my book will cover this in detail. You can also look on our channel. You can also look on YouTube and all. I've done lots of lectures talking just about black box warning and the dangers of NSAIDs, and you'll see how risky it is. Even if you are plant-based, you can still have a heart attack taking an ibuprofen, a Motrin, or Advil, or any of these kind of NSAIDs. So you want to avoid that, and the Bosmeric is our solution. When we look at the mechanisms of lowering inflammation from COVID, then over the last 4 years, there's been dozens and dozens of studies looking at the mechanism of action of each of these plant molecules, and curcumin is one of them. The special form that we use is the one that's been patented and the one that actually has been clinically studied. All the rest, 43% of now generic turmeric and curcumin on the market is synthetically made and has lead contamination, right? So we're really specific on what form, how much, where is it sourced, has it been studied, and then are we delivering it in that level? But we now understand that, you know, we can actually track how these molecules work in the peer-reviewed literatures and studies. And more importantly, I was really happy a few years ago during the pandemic, because it was a big problem. We actually were then able to get the ingredients in our product Bosmeric in a double-blind randomized controlled clinical trial, which is the gold standard that everybody is always asking for when it comes to natural agents. And it was done in a hospital setting during the COVID, and it came out that it was a great treatment. It actually lowered, it improved recovery, less deterioration of the patient, improved their oxygen saturation, lowered the inflammation. It had wonderful results, and so much so that it's actually now a safe and natural therapeutic option, even to prevent post-COVID, blood clotting events. So this is something that's now getting given in hospital now in India, because we're looking at, we can't all get the antivirals, which are very helpful, but they're very, very expensive. And so most countries can't afford some of these pharmaceutical drugs. And now we have the gold standard saying, hey, this is safe, it's natural, effective. But this is even just as a replacement of an anti-inflammatory NSAID. This is something that you can take during your COVID, and more importantly, post-COVID, when people are having pro-inflammatory symptoms. The doctor will say, oh, why don't you just take some ibuprofen? Your muscles are aching. Oh, you're having a headache. It's like, no, we don't want to take something that's causing more dysfunction and risk. We want to take something that actually is helping healing our body, covering 100 different mechanisms of inflammation and improving epigenetic function. So just real quick, I want to show you the differences in curcumin real quick. We have 165 studies, peer-reviewed, published, more than any other competitor. All the other competitors that you can see that have patented forms are really doing test tube trials, meaning that test tube, they're not even doing it in animals or in patients. And anybody who claims 29 up to 270 times, 77 times more absorption in those studies, if you actually look at them, they're measuring metabolites, and those metabolites don't have any anti-inflammatory action. So there's a lot of mismarketing. Higher absorption does not mean higher efficacy at the end of the day. You want proof in the pudding. Do they have studies? And we have wonderful studies that we can show, and that's why our patients get wonderful success. with using it. And then everything else that you see, say on an Amazon or a Walmart or a Whole Foods, you can see all these different brands. There's no safety or clinical data. Again, remember, 43% right now is synthetically made, and a lot of it is having lead contamination. We have a bilayered sustained release caplet. So just it's another aspect of level of expertise that we provide, is using the ancient wisdom of Ayurvedic medicine and also the pharmaceutical science of today, is that we can put it in a bilayered sustained release caplet. What that means is that if you put bromelain, if you put nattokinase, if you put ginger, you put any kind of proteolytic enzyme in a capsule with turmeric or boswellia or black pepper, it will degrade itself as it sits in the capsule, decreasing the potency. We've overcome this by having a specific bilayered sustained release tablet. It has a 20-minute onset of action and an 8-hour sustained release. So even if someone's using the right form of curcumin and having it, in the capsule with the bioprene, you have a nice peak, of the absorption with the bioprene versus regular, but we have the sustained release. So you're having that anti-inflammatory effect for 8 hours and a 20-minute onset of action like a fast tab. And we've done so well, and I like to talk about this because you're doing something well when people copy you. Even large companies, as you can see, are illegally using our trademark, registered trademark, to sell you down something else. And now there's even what we call imitation products, or that are being published on the market. If the name on the bottle is not Bosmeric, but they have the same ingredients, buyer beware. That's all I have to say about that. Now, long solution number 7. We want to look at what do we do when people have fatigue. So there's certain adaptogens. I'm not going to go into too much idea, but there is wonderful adaptogens that we have that are patented, that are water extracted, CO2 extracted. They're organic. They have the highest amount of the what we call standardized active ingredients that we're looking for in a clinical study. Ginseng, ashwagandha, fantastic adaptogens that we give to our patients when they have fatigue and exhaustion. We're helping balance cortisol, blood sugar, and helping with that that gives them a stamina effect. So we're not talking about stimulants. A lot of people I'm drinking a lot of coffee and those kind of things. We don't want to have anything that's a stimulant. We want things that are rejuvenative and are tonics. Andrographis, especially if they have more of this Epstein-Barr virus issue, than if they have nutritional deficiencies. We look at things like what they call cellular energetics like CoQ10, True Niagen. Liver issues like the glutathione or alpha lipoic is down. We have a formula, alpha lipoic, milk thistle, selenium, and N-acetylcysteine that is wonderful, particularly if people have liver dysfunction. Magnesium, B complex. Now, these are only if patients have deficiencies, right? But if they have like low magnesium, most people that we see now who have long COVID, they have about, when we test, an 800 milligram need of magnesium, and we use a chelated form, so there's less GI issues, better absorption. But the average person, when they have deficiency, is about 600. So now we're actually seeing a larger deficiency of that, which again covers 300 different reactions. And then when people have anxiety, we have things that are natural to help balance, the brain function and put them in the meditative state, the alpha state, like L-theanine, and BioRelax is actually a probiotic that we have now that will help with anxiety. We have even products that come from Italy that help with cellular function, like cellular mitochondrial function, and helping that restoration. And of course, Glucan 300, which is our strongest, patented, most studied beta-glucan on the market, stimulating natural killer cell, keeping the immune system up. Because now that people have long COVID, they're more susceptible that when they get another infection, just like a virus, like a normal flu or cold, it really knocks them down. And of course, vitamin D, making sure everybody has a vitamin D level checked. We want that to be around 70. Now, solution number 8 I want to talk about is something which is fantastic, and it's a game changer. What I'm talking about in terms of treatment, when people have now gait instability, dizziness, weakness, taste and smell problems, there's a specific type of acupuncture called neuroacupuncture. I'm actually vice president of what they call the Neuroacupuncture Institute. It's a 501c3 nonprofit institute that we train physicians. And actually, this is our last class that we just trained about a month ago here. And we've trained about 350 to 400 doctors of Oriental medicine, acupuncturists, and MDs worldwide in this special technique. Dr. Jason Howe and Dr. Linda Howe are the two foremost experts in the entire world. They actually live here in Albuquerque, which we are welcomed and are very happy that we have that resource here. I met Dr. Howe when he was training and teaching at Stanford in 2006 when I started learning my medical acupuncture and neuroacupuncture. And then we decided to create a training institute because I saw such wonderful results. Since then, it's great for MS, Parkinson's, stroke, traumatic brain injury, autism, cerebral palsy. These are things that, again, Western medicine, neurology has nothing for. It is fantastic. There's a book that is the doctors use that we recommend, which is kind of the gold standard now. But there's a new book that Dr. Howe produced and just released about a month ago. It is a bestseller. You can actually get it as an ebook. I think he's having it on sale just recently for not much on Amazon. But this has a lot of case stories, case reports, and just individuals, like how they came in, how they're treated. And for post-COVID, there's a little section now just on post-COVID. And on the website, if you go to neuroacupunctureinstitute.org, that's neuroacupunctureinstitute.org, there's a documentary film called Return to Life. And that is a wonderful, it's about an hour documentary film. You will actually see interviews with patients. It was from the director who did 9,000 Needles, a famous director who did a documentary on acupuncture previously, and Doug Dirth, who's a great guy. And actually, I'm in the film because I'm going to be talking about how integrative medicine utilizes and how we can actually improve the function of some of these patients that you'll be amazed that you'll never see. I just had a patient who had gait instability where she was having imbalance and dizziness and also extreme fatigue. She came in, we did the testing, we found the food sensitivities, we found any kind of deficiencies, we've restored her microbiome function, but she still had the gait, so her energy picked up. That was great. Everything else was good. Bowel function was good. But the gait instability, she's like, I'm still having this problem. I'm not able to like walk and do my yoga like I used to, or go do exercise. And then within 4 sessions, when she saw Dr. Linda Howe, completely resolved, like done. And this is amazing because when we look at like certain things that neurology, physical therapy, physical trainers, they won't really understand how this works. It's a specific technique. So it's not just putting, every average acupuncturist will say, oh yeah, we put needles on the scalp. There's a specific form and place and technique and style. And that's why we train people. Anybody who's an MD watching this, acupuncturist or DOM, please go to neuroacupunctureinstitute.org, and we would be delighted for you to be trained and on our directory for therapists. Again, a game changer for those who have any walking, gait instability, weakness, brain fog, insomnia, dizziness, loss of taste, smell, and pain issues. Neuroacupunctureinstitute.org, fantastic resource. And on that website, there's actually a provider directory. And what we're trying to do is train as many people so that in every city, in every state in the United States, over time, we want to have somebody who can provide these type of treatments, because long COVID is going to continue. COVID is still going around. We just had another wave in Albuquerque just about a month ago. And so we all thought it was all done and we weren't thinking about it, and it came and got a lot of people again. And a lot of people that I'm also seeing this year never had COVID. They kind of were lucky that they kind of didn't have it. And again, it's coming back. So these are certain treatments that can be given that can give people a jump ahead on feeling back to normal. And lastly, I want to finish off before we get to the questions and answers of looking at a technology. This is something that is a pulse electromagnetic frequency, or now it's called a pulse electromagnet activation mat. It's called the Cloud. And if you go to Centropix, CENTROPIX.US/RockDoc, you can learn more about that. And if you want to watch a webinar, I go into the detail about this. If you go to our Sanjevani store, SANJEVANI store.com, you look up the Cloud, KLOUD, Cloud with a K. In the link description, there's going to be a link to the webinar, and I go into detail. But what this is a patented device that they've been using out in Europe, and it has a history of use and wonderful studies. But what it does is it helps molecular activation. It helps recharge the cells of the body. So now we're looking at, before I'm like nutrition, using treatments and restoring microbiome and feeding physiological. But now we're using also technology, because some people are so tired they can't even do those things. Some people are just exhausted, or like, I need an extra boost. What can I do right now? Maybe they're transitioning to diet. Maybe they don't know how to cook. So there's a little bit of a rate limiting step on getting better. But here's something that they can lay on a mat, 15 minutes twice a day, and then we can help their recovery. It helps with cellular energy. It does have programs we actually can energize a patient. And for those people who have anxiety, we have a program that actually can help relax it. So for those people want to look at technology, who are like, hey, I'm into technology as well, and I want to eat better, I want to live better. Also, I may not have a neuroacupuncture trained practitioner in my area, or hey, Dr. Pi, I would like to come, do a telehealth with you. I can come help with it. There's even ways that people can rent these devices, and they can just look at, like, can they help restore the function? It increases nitric oxide, it improves capillary blood flow naturally. It helps with the immune system functioning. So these are things that we want to look at a variety of aspects, because it's an integrative approach. It's never just here's one pill, or here's one technology, or here's one treatment. Western medicine and drug companies are like that. You can take this one pill and that's it. We have to look at, like, assessing the entire patient as an individual, and then seeing what we need to do to rebuild and strengthen them. So again, my name is Dr. Sunil Pai. I'm an integrative medicine physician. I'm the head and founder of House of Sanjevani Integrative Medicine Health and Lifestyle Center in Albuquerque, New Mexico. I am available by telehealth and in-person consultations. We see people all around the world. Our phone number is 505-821-6300. And you can email us with any questions at wellness@sanjevani.net. That's wellness@sanjevani.net. Also, our website is sanjevani.net, SANJEVANI.net. That's where you can learn more about me, my background, our clinic, and all of the other providers like Dr. Maureen Sutton, who does Ayurvedic consultations. And we have all sorts of therapies available: acupuncture, massage, float, and of course, sanjevanistore.com, SANJEVANI store.com, where you can look at a wonderful amount of our products that we offer. Everything is evidence-based. We can also assist with picking products for you if you're interested in that. And we also will be having a sale coming soon for Easter. So for those people who want to grab a bottle of Bosmeric or try anything that I might have mentioned, or just peruse our store, feel free. You can also go to bosmeric.com, BOSMERIC.com, to look at and learn more about our anti-inflammatory, or you can get a copy of my book, An Inflammation Nation, at aninflammationnation.com, or on Amazon. It's also available on Audible for those who want to listen to it. And Amy's going to be giving a book giveaway, so someone will get a personalized signed copy of the book. So I'm ready to now stop sharing and answer any questions for you.
Well, thank you so much, Dr. Pai. I am just so grateful for that very detailed and very helpful presentation that you did. Dr. Pai, I wanted to give you an opportunity a little bit to tell us more about things that you do, although you did say that at the end of your presentation. And right now we're going to turn it over to our questions that we're getting.
Sure.
And we have thanks is giving you applause. So thank you. If you click like, then people who are looking at this will know that you liked it. So try to do that too. Thank you so much. We have a lot of people that are giving you applause and thanks.
Thank you.
And thanks. So generous with your time and information. Thank you. I know you're going to be touching quite a lot of lives, as you probably already do.
And it's a lot of information. And what I want people to know is that, a lot of people just want to have a quick solution, a quick fix. And unfortunately, long COVID is a little bit more complicated. And every day we're learning more. But the idea is not just to wait for one solution. The idea is, like, to individually assess people. And what we're looking at with long COVID is kind of not different than what we look at with every patient, but how it affects them is unique with long COVID. And the idea is a lot of people are being turned away from their doctors because they're not hurt, right? They're like, the doctor doesn't know what to do. So it's like, okay, you have fatigue. I don't know what to do. You have gut issues. I don't know what to do. Your colonoscopy was fine. Your endoscopy was okay. Like, I'm tired. I'm depressed. Okay, here's an antidepressant or anti-anxiety pill. We're not looking at underlying cause of dysfunction or imbalance, and we need to restore that function in these patients.
Yes, that's so true. Fix It Rick said, very helpful. Thank you, Dr. Pai.
Thank you.
Okay, so I'm going to go into some of the questions. We had some people email questions, and we also have some live. So, let's go for Jennifer Diamond. Greetings, Jennifer. Have you ever heard of nicotine patches helping with vaccine injury?
No, I haven't. But I wouldn't be supportive of using a nicotine patch for any kind of injury of that level, because nicotine itself is an addictive product. And so there's a little bit of issue, people getting stuck on nicotine patches and some of the side effects of that. So no, I haven't heard that. So I won't comment too much on that.
Yeah. Perhaps acupuncture would be a better
for any kind of injury. So if someone actually has, because people have injuries all the time. physical injuries from, say, a car accident, or even, cerebral palsy, say from birth, or traumatic brain injury, right? For example, like someone who went to Afghanistan or Iraq, or anything like that. And when they have a stroke, or they have a traumatic brain injury, or something that might have happened, there's or even like a myelitis, like even a brain infection, after you've been diagnosed and treated, say Western wise, there's nothing for them. So the patient will have like weakness, or they can't walk, or they can't lift their arm, or even after, say, a simple stroke, for example. And neuroacupuncture is fantastic for that. I mean, you'll watch. I mean, I recommend everybody to look at the documentary Return to Life. You'll see people with MS, stroke, Parkinson's, things that you would never see, that they were wheelchair bound, and several sessions later, it's almost like it's too good to be true. But these are things that, historically, there's cultures that have been doing things. Just because it's not in English, for example, doesn't mean there's not a solution. We're kind of like a little bit American centric sometimes. And it's like, we got to be open to look at from an integrated perspective. As long as it's safe, it's effective, we have data to show it. I don't care whether it's coming from France or Germany or Africa. It's like, we have to be open, because our limitations is only getting us so far of thinking, this way with our blinders on. We have to be open to all forms of healing, and stimulate the healing within, and also respecting traditional medicines that have been used for thousands of years.
Okay. And then Jennifer wanted to explore if infrared saunas might help with the vaccine injury, and wants to know, how is this cloud mat differ?
So yeah, the cloud mat. So just in general in terms of infrared sauna. So I can't speak for infrared sauna and vaccine injury, but what an infrared sauna is doing is, through the infrared wave, is trying to vasodilate the microcirculation, or the vasculature, right? So there's a little bit of improved blood flow. But what the cloud does is, the cloud does that without heat. So you can actually just lay on it. It goes through the clothes. But the cloud is able to actually have different programs. So an infrared sauna is helpful for just kind of like overall. It's kind of like a heating pad, but different, right? It's sending the infrared into the skin, but the depth is only so far, and then that's the limitation of that. Whereas the cloud, you can increase the intensity and the programs, and so it's slightly different. It does increase nitric oxide. It does increase microcirculation. So there's a little bit more of a specificity of use. I don't find any infrared sauna to be dangerous, but I do find people use it too much, meaning like some people that have pro-inflammatory conditions, you also don't want to be having too much heat or too much of that kind of stress. So there's always this limitation of people always want to do more. They want to be like, I want to turn it to 11, or I want to be there, in an infrared sauna or another type of, sauna for a long period of time, like hours a day, or sweating it out or detoxifying it out. That's not how it works. 20 minutes is really a session, 15, 20 minutes. And that's what you would need really for infrared sauna. I wouldn't really be advocating for more than that. It won't do more than what then people will proclaim it to do.
Okay. Well, thank you for answering those questions. I hope Jennifer found that helpful. Okay. Let's go to some of the questions that we had. So Daniel said, I had a tooth implant, and since then, I have had brain fog for almost a year. I don't know if I ever had COVID. Could the tooth procedure be related?
It could be. Some people who have, it's not common, but it's common enough that some people that have implants, or they have root canals, or other kind of dental appliances, they can have sometimes infections in the bone. Not purposeful. That's just like you're dealing with the mouth. There's bacteria in there, and sometimes people with that chronic infection in the bone can have like autoimmune problems. They can have chronic inflammatory problems. It's just the body's trying to fight it. It's kind of like an abscess. So like if they get a blood test, their blood count would be normal. So it's not enough of an infection to raise alert, like, hey, you have a pneumonia, you have a urinary tract, or strep throat or something. But it can be something. So if someone does have a tooth implant and they think like, gosh, since they've had that, then it'd be good to get x-rays or someone to evaluate whether there is any kind of pocket or any kind of infection or instability there. Otherwise, it could be something else that's just non-related. And some people, can get COVID who didn't think, not everybody got tested. And now it's like, everybody's like, you might just get something, you think it's a flu, and it could be COVID. It could also be the flu or a cold. So that's something that, you definitely, it could be if someone's having brain fog. The likelihood would be probably higher of getting COVID, getting brain fog, than the tooth implant getting brain fog. But I'd still, since it happened in that period of time, I wouldn't rule it out.
So it could very well be long COVID then, since it's been a year.
I mean, most people who, and again, the challenge with people with long COVID is that their history, we thought like you had to be hospitalized or you had to be sick. And now it's like most people like, I don't even know if I got COVID. We can test our antibodies, which we used to do. Now they don't do the testing anymore, but we can tell people like, oh yeah, you got exposed or you got sick. And some people like, I didn't know. Or like a lot of people who have like, partners or, significant others or family members, like some of the family members or the partners would be sick for like a week or two. And some people like, I was taking care of them, coughing all over me, touching everything. And I didn't get sick. But then when we test our antibodies, they did get it, but their body, they just didn't have those symptoms to present. So there's a lot of, when we see like this long COVID symptoms, most likely we're going to be shifting that it's most likely going to be exposure, just that people just didn't have the history of having some kind of true illness or that they got a test to show that they were ill.
Right. So at this point, a year later, Danielle wouldn't benefit from a test because they wouldn't.
No, the antibodies, no. And here's the sad thing with the most recent data, which is different than it was, 4 years ago, 3 years ago, and last year, is that as the virus mutates, and that's why the news doesn't cover it anymore, right? Because like it used to be like one thing, and now remember there's like different subtypes, and the strain keeps on mutating. Is that a couple of things are occurring? Is that we can't get the vaccine fast enough to get those. It's kind of like the flu vaccine, right? Mm-hmm. It's not terrible. It's not the best. Why does it have a 30% efficacy in the last 15 years? Overall average rate is highest of 40 something, 45, and low is 15. So average is about 30. Why is it so low? Is just because by the time they get the strain down and they make the vaccine, it takes about 9 months to do it or so. The virus is already mutating. So we're kind of playing catch up. And so in 2020, when we said, here's COVID-19, this is what it is, the original, there was like a 94% success rate using the vaccine at prevention. But as time goes on, so the last study that showed, I saw in January, I haven't been looking at as much as right now because I'm working just more with long COVID rather than, pandemic COVID. But what it shows is that when people get sick, their antibodies were up for about a month. When people got the vaccine, their antibodies were up for about a month. So it's about a wash now. So obviously we want people, there's certain people who are at higher risk. Definitely, you want to get a vaccine because they can put them in the hospital, right? Someone who's maybe older, they have comorbid conditions, and it's not anything to prevent anybody from going to any U.S. hospital better, because right now U.S. healthcare is not so good. So that's a risk of just getting sick and going to the hospital, depending on where you live, particularly if you're in a rural place like I am. Our hospital's not doing as well because we're at 130% capacity every day where I live since the pandemic. So that's not a good place to go. But you have to also look at the flip side, is that it may not be always that issue. We have to look at what else can we do to help lower the risk. And if people who are sick, following the things I'm saying, like if someone gets sick or someone had COVID, you still are still at risk of getting it again and again, just like the flu. They can get the flu, may not have it, get another flu, may not have symptoms, and then get flu again, and like, wow, I'm down. But we do know it does last a little bit longer. Some people, when they've developed the antibodies, the second go round, the third go round, or the fourth go round is not as bad. So that means their body's responding correctly, but it also depends on the underlying lifestyle. So if someone's moving towards an anti-inflammatory plant-based diet, their risk overall of getting it again or getting it and have longer COVID is still lower than the average population who's not. So that's always in their favor to still live this lifestyle. Mm-hmm. However, that doesn't mean that just because I have people like, oh, I don't need to do anything, I don't have to worry because I'm plant-based, I'm green, I juice and all that, and they get sick and they're like, what happened? I'm like, well, the virus is not knowing whether you're plant-based or not. It's not political or, knows about diet. Virus is virus. But we all have inflammation. We all have deficiencies and dysfunctions, and it just sometimes just pushes us over the edge. And that's why when we do the evaluation, you have to look at all those systems, even if someone comes in like, well, I have a spectacular diet. I exercise, I sleep, they're hitting all the epigenetic factors, but everybody's unique, and that's why we have to treat everybody individually when we look at them.
Yes, thank you for that. And it goes for a lot of other things, not just COVID Correct. And long COVID, right. but you have your best chance. So
yeah, I mean, I'll give you an example. Like if I say we see like common things like diabetes or heart disease or obesity, depression, and even cancer. Like a large percentage of my practice are cancer patients, and we improve their outcomes by looking at evidence-based therapies that are adjunct, that are used synergistically with their conventional treatment. We're not alternative; we're evidence-based, right? So we're integrative. But the challenge is that everybody's different. So it's not like everybody gets the same. So even with the long COVID, even though I'm showing like, here's some things that they may get, not everybody's going to get all of those. In fact, some people may get one thing. Some people may not get any of it because if their testing shows differently, it might be like, you need neuroacupuncture, your microbiome is fine, or your nutrition is great, or, depending on, but everybody is different. And so that's why you have to evaluate. And that's why the conventional system is kind of plagued with this plethora of like, we don't know what to do, is because there's not a simple thing that you can do in a 7-minute visit of giving a prescription and walking out the door, right? These things take a little bit of time because some people might have multiple systems of dysfunction from a virus or any kind of illness underlying that was also there. And then some people can have just one area and like you fix it and that's all they need to do. But there's not a simple test like, let me just screen you for one thing and that's it. And that's the challenge where like you have high cholesterol, you eat less animal protein and saturated fat, your cholesterol goes down. Boom, you can reverse heart disease very quickly. There's also natural therapies that can bring it down as well. But the diet is spectacular. But you just can't eat more of the diet and think that things are going to get better when you still have dysfunction, because eating diet is great, but you have to fix dysfunctions or deficiencies or instabilities or imbalances. Otherwise, it's just doing more of the same doesn't necessarily get you better results.
Okay, well, thank you for that. That's very, very helpful. So Benjamin said, I'm having insomnia and I've been trying a lot of medication and nothing working. Any tips will be appreciated.
Yeah, so I'm not a big advocate of using any of the sleeping medications. And the problem with the things like Ambien and Lunesta and those kind of things is that they help people fall asleep, but they don't give people the REM sleep. The drug actually blocks the brain for getting to the rapid eye movement. That's the restorative part of sleep. Every 90 minutes, about a minute or so, you have the part where your eyes are flickering. That's the deep restorative sleep. And people that take those drugs, although they fall asleep, we call it heads in bed in the hospital. Everybody at night gets a pill. The night shift gets to do social media while everybody's falling asleep, so they cannot do their work or don't have to do as much work. But the problem is that person doesn't get that restorative sleep. Then over time they get more tired. So even though they say, "Oh, Mr. Johnson or Benjamin here, takes it at 10 o'clock, he's from 10 to 6, he sleeps, but he wakes up feeling unrefreshed. He feels exhausted and tired. Over time, those patients then can also get more cognitive issues, more neurotic, because you're tired. You're not really sleeping. Even though your head's in bed, you're not getting restorative, healthy sleep. There's natural agents. We have tons of things on our website, just letting you know that are for sleep. If you look at our sleep category, things from drops like homeopathic drops to things that are certain herbs or even to melatonin sustained release forms. I like using flotation therapy. We have a float tank in our office, but you can look at flotation centers or flotation therapy anywhere you live. They're usually all over the place now. This is where you float in a tank of magnesium. It's about 10 inches of water, and it's about 1,200 pounds of magnesium salt, and you're buoyant. You actually float in the water, and water's warm. And in 1 hour, when you fall asleep in the tank, you can't drown because you're buoyant. So you push your hand down, it's going to come up. 1 hour in the tank's equivalent to 5 hours of deep sleep. So when people have insomnia problems and they don't want to take pills because they're on pills. And, I understand a lot of people are coming in with a lot of prescription drugs, 8 to 12 prescription drugs on average. The average person walks in my office and about 10, 15 supplements. So they're carrying bags from the pharmacy and the Whole Foods or whatever it is, and they're still not feeling good. Like, we want to reduce all of these as much as possible. But some things like a flotation therapy is great because it's natural, increases your intracellular magnesium levels just by laying in a tank. And that helps getting people back into that balance. Also, neuroacupuncture, fantastic. Regular acupuncture will also work. So for insomnia. So there's great treatments for that. But those are some simple things I'd recommend.
Okay. And that said, thoughts on, and I'm going to let you say what that is.
Phosphatidylserine.
Thank you. It's a supplement to help with brain health and memory support. Been taking it for weeks to help with brain fog, but not sure it's working, and it's expensive.
Yeah. So again, there's not one single brain nutrient that is better than others, right? It's usually synergy. So like when we use the phosphatidylserine, which is helpful, it's not the only thing. We have a neuroformula forte that we use. That is one ingredient of 8. We look at synergy, right? So it's just like you just don't eat apples. Or you eat oranges. It has vitamin C, yeah, but I can't just live on vitamin C, even though people take vitamin C, even they kind of compound. So we have to look at the synergy of nutrients, and that's what we look at. So that can be helpful, phosphatidylserine, but as it by itself, to me, I would never sell it or take it by itself. It's not as strong, and it's not strong enough to dictate just a single agent. It usually needs to be in a combination formula to have some better results. We have Neuroformula Forte. We have something called Be Mindful, which is a standardized extract of Bacopa. That's an Ayurvedic herb that has wonderful studies. And then we also look at neuronutrients. Like if people actually have brain fog, then as we're talking about, then there might be other things that are pro-inflammatory that are affecting the memory. So it's not like I need to give them brain nutrients. And we have things that actually can regenerate neurons in the brain when people have traumatic brain injury. We have wonderful things. We have studies from that. When people have stroke or, so restoring the brain function is not a problem. But if there's leakiness right now that they're talking about brain fog in the study that came out this week in the patients, then it's like anything that's pro-inflammatory in the diet is affecting the brain. So then it's finding the food sensitivities or deficiencies or toxicities, because now that barrier that would normally protect it from getting in here, they might have it in the body, but it's not affecting their brain function. Now it's like cross the border. The bridge is broken, for example, or the border is crossing and things are coming through. That shouldn't, right? There should be a filing of a line. And so when there's not, the brain barrier is supposed to block certain toxins and certain things, keeping the system from your central nervous system, like your brain and your cerebral spinal fluid, from the regular system. Now, when things are crossing over, that's definitely an issue. So then looking at those things that are now circulating in the body would give that person a better bang for their buck in terms of like, those are the things that are causing the brain fog versus just taking a supplement for my memory.
Okay, well, that was very informative. Angie said, I'm pushing for exercising 3 times a week, incredibly sore and tired, but I feel the need to build muscle and stay strong and elevate my baseline of strength. Any recovery drink ideas?
So a couple things. If this is if Angie, if you're a long COVID person and you're trying to increase the exercise, then it does take a little bit of time, because sometimes when people can, we always have to do is we try to restore that cellular function before they do too much exercise, because the exercise can actually deplete them even more. So they used to be like, hey, I used to be exercise, 45 minutes or an hour, I used to do all this stuff. And now it's like, if I do 20 minutes, I'm knocked down and I'm exhausted. I can barely, it's almost detrimental. So we have to be careful if you're asking this question, because we don't want people to overdo. We want to actually restore the function and then build the strength. What we like to do in terms of recovery drink ideas, again, is testing the nutrients, because if someone has deficiencies, then their restoration or the recovery is going to be limited because they have deficiencies. So it's not like we would then custom tailor, like these are the things that you would need for post recovery, rather than here's just a drink that you should take post recovery for exercise. Now we even have something called Remuscle, which is a specific patented form of peptides which come out of Europe, which those specific proteins actually go to the muscle tissue, and that actually increases the muscle strength and the metabolic function of muscle. So it's not a steroid, it's not an anabolic. They're not going to get bigger, but the muscles get stronger. So we give this to people who are, as they get older, we get a little sarcopenic, we lose muscle. Like so when people are 80, we're kind of a little bit smaller sometimes. Also for athletes, we want to increase our strength, but not necessarily everybody wants to be Arnold Schwarzenegger. We need to have bigger muscles. We want to have stronger muscles of who we are. And so there is certain kind of specific products that we give, like Remuscle, that can be given, or doing the testing and then finding out what their deficiencies are. And it'll also test, I'll give you an example on the nutrition test, their amino acids and all these other things as well. So some people like, am I getting enough of this or getting enough of that? We can actually assess that.
Okay, thank you for that. So Jeff said, I'm dealing with long COVID, 20 months, chronic fatigue, headaches, body aches, finally less fatigue, headache, and increased energy levels. Just got COVID again. Will this set me back?
Oh, I'm sorry to hear that. But this is going to be a common thing that, because remember, it's going around, and just because you had it once doesn't mean you won't get it again. And since our antibodies, unfortunately, are not lasting as long as they were before, and usually what strain he's getting now is different than what he got before, or all of us, by the way, then it is an issue. You can be set back twice. And so our whole goal moving with our patients is not just restoring their function, but there's certain things that we can then get them stronger, because we have to prevent them from getting the next round. Right? So like it won't be as detrimental as the first time we got it or the second time we got it. Now, some people, as they get stronger, as we help them with their regimen, then it's like, oh my God, I got COVID. It wasn't as bad as the first time, or it wasn't as bad as the second time. So that's a great thing. But some people who, by the time we see them, like they've had their third or fourth time, they're continuing this decline because they were never able to be brought back to their baseline. And then it's just knocking them down. And again, all these other things that are still pro-inflammatory in their environment and their dysfunctions, those things were still there already. So just it's another level that's knocking them down, and that levies is easily to be breached very quickly.
Yep, that it sounds like you have some great solutions that could be helpful to people. So Anthony wants to know, does maca tea help with long COVID?
I haven't seen. I mean, there might be some studies on, but polyphenols and the antioxidants from matcha tea or any tea. We want to make sure it's organic because teas are heavily sprayed. Is always helpful for people. It helps with lowering inflammation. So I wouldn't. Again, it's not going to be like just take this and you're done. But is that something that people could be bringing into their diet that would have health benefits? Absolutely. One thing to know with all teas, matcha included, but teas have to be boiled at certain temperatures. So you always want to get a boiling kettle that has I always, when I see patients, I'll show them, like, here's the kettle that you get that has different levels of temperatures for the different teas, because you don't want to just be buying organic matcha tea, which is expensive because it's good for you, right? If you buy the better stuff, it might be like $40 or $50 for a little canister of real matcha tea. And then they go get boiling water and they pour boiling water in it, and then you just destroyed all the polyphenols and antioxidants and health benefits. So when patients see us, like, we were that level of excellence, and like, how do you get food as medicine, but to actually work as it is intended? A lot of people read a study, a lot of people are like, I heard it's good for me, and then they go to the local coffee shop, they get some and they put super boiling water because that's what they serve at the coffee shop, and it kills all the benefits, and like, they're not getting that value which the patient intends. And we always want people to get their bang for the buck. They're making the extra effort to take a supplement or to do a smoothie or to eat food or to grind something or cook something. And what we've done in the last 24 years is, through trial and tribulation and error and perfection, is how to make that easy for the patient, how to decide, like, what is a better blender, what is a better water kettle, like, what is, because we want people to then enjoy and get the maximum benefit. But what happens is, when people don't get that guidance, they try something, they might not understand how to use it correctly or to get the full benefits, and they go, "I didn't work." And yet they miss a perfect opportunity where food can be medicine, or plants have a really wonderful healing aspect.
Okay, well, thank you very much for that. That's important to know. And by looking at your background, there's that you have on today for your screen, you are very familiar with the healing
The healing
potential for
spices.
spices
Correct.
and teas and all kinds of things. So, I'm glad that you put that in your background, because there's just so much knowledge that you have to share with us. And
Yeah, we do
I would
cooking
love to have you
classes.
back, because I think that you could share a lot.
Yeah, we do cooking classes. In fact, this last weekend we had a outing where we went to a local Indian restaurant, because many people, even though they're my patients, they've never been to an Indian restaurant because they won't know what to order. I understand that. So, like, we're like, here, these are things that you can order plant-based. This is what it is, and like, get people get
Yeah.
their hands, like, because understandably, we want to understand all these spices. We want to try different culture foods, understanding why blue zone people live longer. What and what are the reasoning why we use these spices as medicines, and that's one of our expertises that we provide. And if you watch me on YouTube or any of our channels, if you go to our website, sangevni.net or sangevni.store.com, you can sign up for our newsletter, and we will be launching our podcast coming soon called Take Back Your Health. And that will be a program that we're going to re-kick back. We used to be we had a radio program 5 years ago. It was fantastic. And now we're moving to the podcast world. But this is where we're going to go into deep dive of all these types of topics. And then I definitely would like to enjoy inviting you to join us on our side. And so you
Oh,
can talk about your story and stuff like that, because, I'm a science guy, I'm an evidence-based, person, but it's always wonderful for people to hear from the patient consumer side of, like, I did this, and like you do in the beginning, like, this is how much weight you've lost. And people need to hear from both sides. They need to hear that from the doctors and from the scientists, but they also need to hear from the regular person. And I really kind of avoid this misinformation where, like, we're starting to see on social media, where there's a lot of bad information on health, or there's people who proclaim that, that they're health gurus. And yeah, they might be a case off or a one offer, but we really want to look at, like, what's for the majority of people. How do we really move and shift them using evidence-based, plant-based forward plant diets, and using, natural therapies and less drugs if needed.
well, that's wonderful. Yeah. So, and I'd be honored to be on your show, and I'd
Yeah,
love to invite you back to be on mine.
sure.
And I really want to thank you again. I'm just so appreciative of all the information that you shared, because there's, like you said, there's just not too much available to help people who are dealing with COVID and long COVID, because there's just not enough information in the standard
There
medical
isn't. And we're
community
able
to
to do
help
things by
people.
telehealth. So, like, even if people can't physically come to our office, we're able to send all the lab testing kits and everything that we need to do that. The other thing is to let everybody know is that we don't upcharge on labs. So, unlike a lot of doctors or unfortunately a lot of the health coaches that you see out there, their main revenue is by like charging fees on labs and then selling labs and stuff like that. We don't do that. It's like, this is how much it costs. You're sometimes your insurance covered, or it's the cash pay. You deal with them. We'll give you the stuff to do that. But my job is to interpret that data and assist the patient on how to get better, because we want to save the money for now therapies or treatment, or go see somebody to do neuroacupuncture, or go get a float session, or go get a massage, or go get a juice machine, or the right water kettle for your matcha. Like, there's certain things that we really want to help and assist the patient do, rather than just like, oh, here's test. But we can do it for people all around the world. We always find a way to get them to get their testing, because we want to provide something that the regular conventional doc is not able to, or doesn't understand, or doesn't have the education to assist them in getting better.
Well, that's very good. I wanted to remind our Green Warriors that we are doing a book giveaway for Dr. Pai's book, and it's Inflammation Nation. And I have in the show notes, I'm going to have up to 6 ways for you to enter. And if you follow me on begreenwithamy.com and YouTube, Facebook, Instagram, you'll see posts about that as well. It'll be in the show notes. And you can enter for a chance to win a signed copy of his wonderful book, which I have been reading. And with all the interviews that I've been doing over the years, I love when I can open up a book and say, I didn't know that.
Yeah. Thank you. I really
So
appreciate that.
I've been really enjoying this.
Yeah, because it's not everybody,
Yeah.
like, for your people who are plant-based. Yeah, we know we should be eating healthier plant-based, but it's looking at everything else, from the microbiome, for the environment, for even just stress, community, epigenetic factors that we're looking at now. Like, these are important: diet, lifestyle, environment, belief system. So the belief system is important, and those are things that sometimes are not expressed in the plant-based community, right? They're just like, diet, diet, diet. Here's a recipe, but we want to look at, like, what else do we need to do to make that optimum.
Okay. I did want to mention also that we are having another book giveaway for Dr. Neil Bernard's newest book, The Power Foods Diet, which is not yet released, but you can go to the link that we've provided if you want to go on a wait list for it. But you will also have an opportunity to win that in the same way. I'll have links from my website and through social media. You can find out, and we'll put that in the show notes as well. So I just wanted to let everybody know, and he'll be coming on the show to talk about his book and about all the valuable things that he can share with us about weight loss. But I really want to thank you, Dr. Pai, for your invaluable insights and expertise, especially in navigating the complexities of COVID and long COVID, and your dedication to holistic approaches in addressing these challenges it's just truly commendable.
Thank you very much. I appreciate it. And thanks everyone for listening.
So what's your final take-home message for our Green Warriors?
So there is hope for recovery, and there's actually solutions for recovery, especially from long COVID, but it's no different than any other condition. So although people feel that they're the only people and no one's listening, there is opportunity and solutions for getting better. So there's always room to heal, and we just always will keep pushing and fighting for our patient to stimulate their body's innate ability to heal using the most natural evidence-based therapies possible.
Oh, thank you so much for that. Green Warrior, tell us what are you going to remember from today? One of my takeaways is that it's valuable to test for sensitivities and resistance to treatments. That was a very good takeaway for me. I also wanted to thank Jess Task Voice. She did the countdown, she did the promos, and Jess Task Voice, tell us who's coming up next.
You know what I wish? I wish that eating food would help me lose weight while still being delicious. You too? Well, don't miss our upcoming episode with Dr. Neil Barnard. There's a surprising connection between food and effortless weight loss. We'll discover how simple dietary changes can lead to a healthier, happier you. Your questions answered Wednesday, April 3rd, 3 p.m. Eastern, noon Pacific, on Be Green with Amy Live.
And thank you, Green Warrior, for joining us today. Your engagement and support make these discussions meaningful and impactful. And we really appreciate your time, and we look forward to connecting with you again soon. And please stay tuned for more empowering content. Please remember to subscribe to my channel, share my message with others who can benefit from our discussions, because together as Green Warriors, we can make a meaningful difference in the world. And as a special thank you to all of you, I am offering you 5 free recipes. So just go to begreenwithamy.com/join, and I will send you 5 free recipes of delicious whole food plant-based food that is SOS free, no sugar, oil, or salt, but it's really delicious. And I think all of you who are watching, especially today, will probably need this. So go ahead and take your left hand and grab your right shoulder, and take your right hand and grab your left shoulder. Now squeeze, because that's a hug from me to you. It's a hug from me to you, Dr. Pi, because
Thank
you
you,
are just
and me
so
to everybody
helpful.
else too. Let's give the world needs a hug right now. So
Oh, yes,
that we all need
absolutely.
a little. Love goes a long way, right? All
Yes,
we need is love, right? That's what John
that's a
Lennon
part of the
says.
healing.
It's
That's
part of the
another
healing.
part of
Yes.
the healing, absolutely. And so if you'd like to join me and Dr. Pi with my tagline, go ahead and type that in the comments as we say it together. Are you ready, Dr. Pi?
Yes, we are.
Okay. Well, until I see all of you again, remember, be
Be
strong,
strong, be
be
well,
well, and be
be green.
green.
Thank you, everyone.
Thank you, Dr.
Thank
Pi.
you.
Thank you so much. Thank
Yes.
you, Green Warriors. We
Best of
hope to
health to
see all
everybody.
of you soon. Thank you.
Thank you.
Looking for really tasty recipes that are SOS free? No sugar, oil, or salt. How can it taste good? Well, if you like flavor, then you'll love this Be Green with Amy recipe ebook. Get your copy today. Click on the link in the show notes. Be strong, be well, and be green.